Well, look, I think this is an area where actually it strikes across the community, and there can be a cross-party effort where we can work together to try to improve services across the board in the interests of users of the service, and indeed in the interests of supporting families. And I do think, and the reason for our proposal today, I wrote to the Chief Minister, and I've written to Marlene Hassan as well, to suggest that we establish a select committee on mental health services, specifically with that birth, so that it can then have a major effort in collating information, in assessing the life experiences of different people, in hearing professional expert opinion, and then coming up with recommendations that side by side with whatever government is doing, because we recognize that there is political willingness across all parties to improve these services, it can assist that effort.
Well, in Parliament last month, it was revealed that there are over 4,000 patients in Gibraltar who, in 1 year, have been prescribed antidepressants or antipsychotic medication via the GHA. Has this been the trigger point for you wanting this select committee?
It's not the trigger point, because I think, when you saw the last election, the election manifestos of all three political formations, they all had put mental health services and improvements in that area as one of the key issues that were all wanting to talk about. So that wasn't the key issue for us, because this goes back a long way. There have been concerns expressed publicly in this community about mental health services, about making improvements, and there's a lot of good work that is done by the professionals and NGOs. But of course, the parliamentary questions that we asked, that the GSD asked recently at the last session of Parliament, they have brought to the fore that 4,000, as you say, 4,000 people have been prescribed either antidepressants or antipsychotics in 2019 only by the public health services. So that alone is an indicator of why I think it's important also to assess this area, to work together if we can, and make improvements to the service. And I really hope that the Chief Minister and indeed Marlene Hassan and Together Gibraltar do respond to our invitation, and that we can work together on this issue.
You heard what the Chief Minister had to say in Parliament on this issue, that it's not necessarily a bad thing that so many people are coming forward and speaking openly about mental health, and that we shouldn't create a taboo subject regarding the prescription of medication. Do you share these views?
Well, look, neither the Chief Minister or I are professionals or experts, and I think it's certainly important that the mental health services should be there, and if the clinicians believe that a patient should be prescribed certain things to improve their life, of course they should be available. But that's not the be-all and end-all. That is dealing with consequences. It's not dealing with causes. And I think it's important that when you look at mental health provision, and you're not just talking about improving services at the tail end once things have happened. Are there issues that in this community we can do to better improve, say for example, the regulation of social media, because that may have an effect on mental well-being of people? Is there any other contributing factor in our community that we can help with to address causes rather than consequences? So all those issues, I think it's important to hear lifestyle experiences of people and families. I think it's important to hear professional opinion. I think it's important to have a constructive, proper debate. In the political cauldron, things are said sometimes in question and answers. I don't think that's particularly helpful. And I think this is an opportunity for all of us to identify an issue where we can work together, and I hope that people respond constructively to our invitation.